So did you feel like you were stepping into a gap in the market?
Yeah, absolutely. I think that the market is almost bipolar. Actually, you've got at one end of the spectrum the NHS, and at the other fairly high-end private practices, and there's a bit of a gap going on in the middle. Now, some practices are filling that quite well, but I think in general terms, it's that sort of structure. Personally, I think the NHS is, in some ways, is a fantastic service. There's no denying that, but in some respects, almost does a disservice to some industries. And I think that many patients' perception is that a checkup costs £18.50 and that fillings and lots of remedial work is only worth £49, and actually that creates a perception for many people that this is something that I should access very, very cheaply. And it's, as with all things, it's not about the price, it should be about the value. And then on the other hand, you've got these quite high-end, expensive private practices where sometimes the pricing is not as transparent as it should be, and you're not sure exactly what you're going to pay. I think what we've tried to do is fill that, very much that middle ground that's very straightforward and honest about pricing. You know what you're going to get. You'll know you're going to get the time and the care and the accessibility that you might not be able to get within the NHS. So our model is all about availability and time and affordable but private.
So what's different? Why is visiting one of your clinics in a Sainsbury's better than going to my usual local dentist?
I think there are some practical differences in that from an access point of view, you can park very easily, you can come in at 8 in the morning and you can come in at 8 o'clock in the evening. So you don't have to change your life in order to access the dentist. It can be done around what suits you.
So what are the opening hours?
So we open 8 till 8 Monday through Friday, 8 to 6 on Saturday, and 11 through 3 on Sunday. And the reason we're shorter hours on a Sunday is obviously the supermarkets are restricted on Sunday hours, so we have to work around that. But the important thing is that you can access a dental practice 7 days a week, and you can come in the mornings and you can come in the evenings. So if you look at people, again, that are very nervous and worried about going to the dentist, what they will do is they'll put all these barriers in place. I have to take time off work, or it's very difficult for me to get to the practice. It's very expensive, therefore I can't afford to go. And what we're trying to do in this environment is simply just take each of those barriers away, so that actually what happens is people kind of run out of excuses not to come. I can go in the evening, it's not going to cost me a fortune. I can actually wander into this practice and have a chat with the dentist or with the team at the front desk without committing to anything. And so if you walk into one of our practices, you'll find that the reception area is a bit like a confessional, where people sort of stand at the door and say, please forgive me, Father, I haven't been for 25 years, and see what sort of reaction you get. And if the reaction is, oh, don't worry, that's absolutely fine, we've got people who haven't been for a lot longer than that, then each week they get further and further into the practice until they're happy to commit to actually seeing somebody. And I think that's a very big difference to if you're purposefully ringing up, making an appointment, going to a dental practice. Chances are you may never have met that clinician before, you may never have met any of the team before, and before you know it, you're lying down with your mouth open and hoping everything goes well. So our experience allows them to get into that whole process in a much slower, more gentle way. And whilst we encourage all of the teams, dentists included, to get out onto the supermarket aisles to talk to people, we have a very strong message that goes to those teams that if anybody tries to sell anybody anything, then that's a big issue for us. So it's not applying retail skills from the point of marketing in a sales way. It's about saying, would you like to come and talk to somebody and understand how this works? And I think one of the interesting things in dentistry is that the vast majority of people do not know what many of the treatments are or what many of their options are.